everyone, my name is Jaya and basically I am from the Bhagalpur district, Bihar. Actually, my mother was diagnosed with brain tumor few months ago in the month of May. So she have been struggling with like unbalancing, hearing sound. So the symptoms, like she was unable to walk properly, like hearing problem, and sometimes the right side of the face it was little bit paralyzed. But she was not getting such kind of headache or any kind of severe that she is not able to like speak properly. These were some of the symptoms of her. But recently when we come to Kolkata hospital, that is Rabindranath Tagore, which is in Mukundapur, so we get diagnosed with several doctors. Then my mom, she was diagnosed with the such disease which is brain tumor. Actually she have the brain tumor in her cerebellum, and the size of the tumor was so big, and we were so much of scared of this, like how it's going to be happen, like how the treatment will be happening, and we are so much of scared of this. But first we diagnosed with the Arindam Biswas, then he suggested to go to the neurosurgeon, that is the Amitabha Chanda. So when we diagnosed with under him, so there was several process which was going through. But after the doctor suggested that it's the best option to will go for the brain surgery, because we can also go for the radiation, but the thing was like brain surgery was the best, because when we are giving the radiation, so little like some, you can say कुछ वहाँ पे रह जाता. So again it's it was the brain tumor, so it was in a slowly growth. So he suggested for the surgery, so we agreed on it. And finally after the operation, it was the long operation, but it was very successful operation. My patient is absolutely fine, and she is not facing any such kind of issue like previously which she was facing, like she was unable to walk properly, unbalancing, hearing sound, and the face was paralyzed. I would like to suggest like we should go to the best institute, best medical hospital, and also I would like to say like we should go for the doctor, best doctor according to the neurosurgeon, because we see that the several people are here, like they are misguidance, so don't get misguidance of any of the doctor. So it's, I'm not saying, I mean to say like we should not misguide to any of this, and we should take care of our loved ones very much, because we know the pain how much we love and losing of them. So I would like to say that the Dr. Chanda was excellent, and patiently he handled the patient, and it was a successful operation. Rabindranath Tagore was the hospital where she got diagnosed. It was good, it was so good, and like medical staffs and nurses and they were all polite to us. Like in fact nurses, she was admitted here for 7 days, like she was very, like all the staffs are very polite, no doubt in that. So I would like to suggest like just go to the best doctor, don't get misguided to any of this. So thank you all.
Hello everybody. Mrs. Kiran Devi came to me a couple of months back for some problems, like she was having balance problems, and then weakness of the right side of the face, and diminished hearing on the right side, and I advised for an MRI. The MRI showed a large tumor here in the base of the skull, severely compressing the brainstem. This is the brainstem and this is the cerebellum. Just to orient you, this is the slice of the head, and these are the two eyeballs. This is nose, this is right side, this is left side, and this is back of the head. So the tumor was on the right side, quite deep, and as we go up, it's showing that's a large tumor. This white one is the tumor, and you can appreciate that this is severely compressing the brainstem and the cerebellum. So this tumor was creating all the problems for her. The family was very scared, and when I told them that there is a chance that this paralysis on the right side of the face could be permanent after surgery, they got very scared and asked me whether there is any alternative treatment. So I said that there is an alternative treatment called radiosurgery, that is stereotactic radiosurgery. That is not a surgery actually, that's a radiation treatment. So they tried for that radiation treatment, and I sent the patient and the family to the doctor who does the stereotactic radiosurgery. This is X knife or gamma knife. But the doctor there told that the tumor is too large for this kind of treatment, radiation treatment, because the amount of dose required will be too high and could be injurious to the brain, and there might be serious injury to the brainstem which can be lethal. So the doctor said that it will be better if she undergoes surgery. So I told them that after surgery there could be a chance of facial paralysis which might be permanent. They agreed to that. Since I had some other bookings of surgery, so I gave them a date on end of June, and they agreed to that and waited for me. She underwent a big operation. It's a long operation. The actual operation took almost 6.5 hours, and she did very well. Although initially there was some weakness of the right side of the face due to handling of the facial nerve, but it is improving very rapidly, and the facial paralysis has improved almost to complete extent. Today she has come for follow-up for removal of sutures, and she is very happy. The facial function is coming back. Her balance has already improved. She is walking without any support now. And we did a post-op CT scan contrast, and it showed complete removal of the tumor, and there is no tumor. And these are the kind of tumors which the chance of recurrence is very low, and I sincerely hope that she'll be completely cured and the tumor won't come back. Thank you very much.